South Korea saw its new COVID-19 cases on Wednesday climb above the 400 mark for the first time in 4 days, after a few days in the 300 range. Yeon-seung with the details.
South Korea on Wednesday reported 444 new coronavirus cases, 426 of which were locally transmitted. And a whopping 83% of the local transmissions were from the Seoul capital region. Many of these cases came from a spike in infections in the city of Dongducheon in Gyeonggi-do province. Just in the first 2 days of March, this area alone saw 105 new infections. Contact tracing is on the way, but the process has been stalled by a language barrier, as foreign workers made up most of those infected.
Foreign workers often have difficulty understanding prevention guidelines due to their language or other problems. Also, due to their relatively poor workplace or accommodation conditions, they are more vulnerable to infections.
Meanwhile, the temporary COVID-19 testing centers are finding otherwise hidden coronavirus patients. Amid Wednesday's tally, 113 cases, or more than a quarter of the day's local infections, were found through these testing centers. And another COVID-19 case was found among the inmates at a Seoul detention facility. Health authorities fear that this could potentially spark another outbreak at the densely populated facility. 6 more deaths were reported on Wednesday, bringing the country's death toll to 1,612. Yeon-seung, Arirang News.